Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Why is female catheterization essential, you might ask? This procedure, far from being a mundane aspect of healthcare, is in fact a medical marvel, a veritable lifesaver in many instances. Its importance cannot be understated. It's like a key, unlocking relief from urinary retention, a distressing condition where one is unable to empty the bladder. In these cases, catheterization offers an immediate solution, restoring comfort and preventing further complications. But it's not just about relief. Female catheterization is also a crucial tool for obtaining sterile urine samples. This is invaluable in diagnosing urinary tract infections, bladder conditions, kidney diseases, and more. And let's not forget its role in managing incontinence, providing those affected with a means to regain control over their lives. Indeed, the value of female catheterization is multifaceted, touching on relief, diagnosis, and management. Understanding the process can ease anxiety and promote a more comfortable experience for the patient. So let's delve in and explore this vital procedure together. Before diving into the process, knowing the anatomy involved is crucial. Let's take a look at the female urinary system. It consists primarily of two kidneys, two ureters, the urinary bladder, and the urethra. The kidneys filter the blood, creating urine which then travels down the ureters to the bladder. The bladder stores this urine until it's ready to be expelled through the urethra. In female catheterization, the catheter is inserted through the urethra to reach the bladder. It's worth noting that the female urethra is shorter than the male's, around 1.5 to 2 inches in length compared to the male's 8 inches. This difference in length makes the catheterization procedure distinct for females. Understanding the female urinary system, and particularly the urethra, is fundamental to successfully and safely performing a catheterization procedure. An understanding of the anatomy can lead to a smoother procedure and lower risk of complications. Now it's time to break down the process of female catheterization into easy-to-understand steps. First, let's discuss preparation. The patient should be in a supine position with the knees bent and legs apart. The area around the urethra needs to be cleaned using an antiseptic solution, ensuring that we move from the front to the back to avoid the spread of bacteria. Next, it's time to prepare the equipment. Gather a catheter kit, which typically includes a catheter, lubricating jelly, sterile gloves, and a collection bag. It's paramount that you put on your sterile gloves before handling the catheter and other sterilized equipment. Remember, sterility is non-negotiable in this process. It's the key to preventing infections. Once everything is set, we can proceed with the insertion of the catheter. Lubricate the catheter tip and the first few inches of the catheter. This will ensure a smooth and comfortable insertion. Carefully separate the labia and locate the urethra. Slowly insert the catheter until urine begins to flow, then insert it a bit further to ensure it's positioned correctly in the bladder. After insertion, attach the catheter to the collection bag. Secure the catheter and bag to the patient's leg to prevent tugging or pulling, which can cause discomfort or even dislodge the catheter. Finally, let's talk about aftercare. Monitor the patient's urine output and the condition of the catheter site. Any signs of infection like fever, pain, or changes in the urine should be addressed immediately. The catheter site should be cleaned daily with soap and water and kept dry. Remember, the patient's comfort and safety are paramount. Always explain each step to the patient before proceeding and ensure they're as comfortable as possible throughout the procedure. Though it might seem complicated at first, with practice, healthcare professionals can perform the procedure efficiently and comfortably for the patient. In summary, here are the main points about female catheterization. This medical procedure is crucial for numerous reasons, from aiding in diagnosis to providing relief for patients with bladder dysfunctions. It's a delicate process that requires a thorough understanding of the female urinary system's anatomy, specifically the urethra and bladder. The procedure's success hinges on careful execution of each step. Preparation is key, from gathering the necessary equipment to ensuring the patient is comfortable and informed. Sterilization is non-negotiable to prevent infections. Lubrication and gentle maneuvering of the catheter can significantly reduce discomfort and potential trauma to the urethra. Understanding the anatomy is critical. Remember, the female urethra is typically shorter than the male's, meaning extra care is needed to avoid bladder injury. Lastly, the catheterization process should be carried out with patience, ensuring that the catheter is correctly positioned in the bladder for effective urine drainage. Remember, knowledge and practice are the keys to a successful catheterization procedure. UMCC, your ultimate medical consultant connectors.